Bismillahirrahmanirrahim. Hello everybody. So a 43-year-old patient, gravida 6, para 5, at 39 week of gestation has a brief generalized tonic-clonic seizure in the delivery room. She became disoriented, lightheaded, breathless, and cyanotic 20 minutes after an uncomplicated spontaneous vaginal delivery of a healthy neonate and placenta. Her pregnancy was uncomplicated and she has no past medical history. Her blood pressure is 80 by 40 mm of Hg, pulse 110, respiration are 13 per minute. Oxygen saturation is 75% on face mask. Examination shows an unconscious woman who is no longer seizing, a generalized purpuric rash, and bleeding from the intravenous line side are seen. Which of the following is the most appropriate next step and management of this patient? Abdominal ultrasound, B. Intramuscular magnesium sulfate, intravenous furosemide, D. Intravenous heparin, E. Intubation and mechanical ventilation. So, first of all, this patient have multiple pregnancy. I will write the hand here. This patient have multiple pregnancies. This is the first hint. The second hint is that this patient having generalized tonic-clonic seizure in the delivery room, in a tonic-clonic seizure. Third hint, that this patient became disoriented, lightheaded, breathless, and cyanotic. The fourth hint is that this patient having respiratory rate is equal to 30 per minute. So this means that this patient having respiratory failure. Number fifth hint, that on oxygen mask, oxygen saturation is 75% with oxygen mask. With oxygen mask. Sixth hint is that this patient is unconscious. So first of all, what is the diagnosis of this question? Diagnosis of this question: the first, this patient has multiple pregnancies. Second, she having brief generalized tonic-clonic seizure. Third, she became disoriented, lightheaded, breathless, and cyanotic. Her respiratory rate are 30 per minute, and oxygen saturation with face mask is 75%. And she, and on examination, showed that she is unconscious. So, as we already know from the hand that this patient is suffering from respiratory failure and hypoxemia, because she having the respiratory rate which is very high, 30 per minute, and she also having the oxygen saturation which is very low, 75% with oxygen support. So this patient has amniotic fluid embolism syndrome. I will explain to you that what is amniotic fluid embolism syndrome. So first of all, we have to know that what is the diagnosis of this question. So here, the correct option is option E, intubation and mechanical ventilation, because first we have to care about the patient oxygen saturation. First, we will intubate and mechanical ventilate the patient. After that, we will go toward the other option. So why choice E is the correct one, intubation and mechanical ventilation? Because this patient presentation is concerning for respiratory failure from amniotic fluid embolism syndrome, which is a very rare but catastrophic complication during pregnancy or shortly after delivery. Amniotic fluid can enter the maternal circulation through endocervical veins, placental insertion site, or area of uterine trauma, for example, previous cesarean incision site. This leads to an inflammatory response causing vasospasm, cardiogenic shock, hypoxemic respiratory failure, and coagulopathy with disseminated intravascular coagulation. Hypoxia can lead to seizure and loss of consciousness, as this patient is suffering from seizure and tonic clonic seizure, and respiratory failure from hypoxemia. The choice come to the choice A. Why the choice A is incorrect? Abdominal ultrasound. So abdominal ultrasound can assess for intraperitoneal bleeding, which can be due to uterine rupture and in multifarious patients, such as in this patient. Although massive hemorrhage can cause hypotensive shock, this patient rapid respiratory decompensation require intubation for ventilation support before performing ultrasound. Choice B, intramuscular magnesium sulfate. So, as we already know that intramuscular magnesium sulfate is for eclamptic seizure. So the patient with eclamptic seizure present with hypertension, not hypotension. Come to the choice C, intravenous furosemide. So which is already know we can know that if furosemide, we already know that furosemide is a diuretic. So intravenous furosemide we can use for the treatment of pulmonary edema and improve hypoxemia due to fluid overload. Choice D, intravenous heparin. So heparin should not be administered in a patient with significant bleeding or sign of platelet dysfunction, as already this patient having purpuric rash and bleeding from the intravenous line side. So on this case, the heparin is contraindicated. I will revise again why the choice is a correct intubation and mechanical ventilation, because we can, as we can already know from the question there, the question here almost given 90% of hint toward the diagnosis of this question. So the first hint is that this patient is multiparous, mean that she having multiple pregnancies, plus she having generalized tonic clonic seizure. With she became disoriented, lightheaded, breathless, and cyanotic. Her respiratory rate is 30 per minute, and oxygen saturation with oxygen support is 75%. She having unconscious after that. So we already know that there is diagnosis of this question is amniotic fluid embolism syndrome. So amniotic fluid can go to the fetal, the mother circulation to the mother lungs, which can cause a vasospasm reaction, and the patient will become unconscious from hypoxemia. So first we have to intubate and mechanical ventilate the patient. After that we will go toward the other option to correct her hypotension and everything else. So the diagnosis of this question is amniotic fluid syndrome, and we can intubate and mechanical ventilate.